Okay, good morning, everyone, and welcome to our first ever video Accelerate. Special thanks to Chad and the staff for putting this on. We look forward to gathering in person once a month, and we'll look forward, hopefully, to doing that in the future. But we appreciate the efforts you've gone to help us again network by video. So thanks, Chad and staff. As most of you know, the Accelerate program is designed to connect our members and drive business in our local community. Each month we have special guests, we hear updates on issues that pertain to our regional and statewide issues and things that affect us locally. Today, we are excited to hear from Dr. Italo Subbarao, and Dr. Subbarao's topic will be fostering wellness during the COVID-19 pandemic. Dr. Subbarao is the Dean of the College of Osteopathic Medicine at Carey University. So thanks, Dr. Subbarao, for agreeing to do this today. We also would like to offer a special thanks to our sponsors, Forest General Hospital and Carey University. Before we get started in the program, Mike Dixon will offer the invocation. Mike is with the Pine Belt Foundation. He'll be followed by Alan Anderson, who is our Chamber of Commerce Division Chair, and he will recognize our new members and provide a few announcements. So again, welcome everyone. And Mike, if you would like to offer the invocation, please.
Happy to, Hoppy, thank you. As strange as it might feel to do so, please join me in prayer. God, we gather thankful that though we are separated, we are not alone. Thankful that you are not just a creator above this world, but you are a God who is with us. God, today we humbly ask for healing for those who are ill, protection for those caring for the sick and the vulnerable, comfort for those who are mourning, and community for the isolated. God, we ask for wisdom for our decision makers and a continuing commitment to love and sacrifice from all of us. May our time apart give us a fuller sense of your grace and a deeper sense of that which has lasting value. We ask this in your abiding name. Amen.
Good morning. This is Alan Anderson. I am honored to announce and welcome some of our newest members to ADP, the Academy of Hair Design, May Jewelry Designs, my neighbor here at the Anderson Design Center, Hattiesburg Paint and Decorating, LLC, Lulabelle Weddings and Events, Right Track Medical Group, Serve Pro of Hattiesburg, Thrivent Financial, James Garraway. To find out more about new members, please just visit the ADP.com to view their member listing, and you can find their social media and website hookups. And please do follow up and always consider members. Before moving forward, I have a few more announcements, and that would be first, Friday, May 8th, 2020 is the Pine Belt Young Professionals Emergency Community Blood Drive. We'll go from 10 to 4 at Lake Terrace Convention Center. To schedule your donation, find the event on www.theadp.com/calendar. And also the next Accelerate will be Friday, June the 5th, and that will be from 11 to 12 again, and it'll be a panel discussion entitled Don't Ignore the Warning Signs, How to Thrive and Survive During COVID-19. The sponsor will be Merit Health Wesley, and again, it will be on Zoom, and again, to register, go to the adp.com calendar. And now we'll have Dr. Lynn Houston, Associate Vice President for the University Enhancement at Carey University, who will provide sponsor remarks and introduce our speaker. Thank you, Dr. Houston.
Good morning. How are you today? And good morning, ADP. On behalf of Carey University, Dr. Tommy King, we would like just to give you a glimpse of yet another chapter of Carey University. Carey University, like so many others, has faced fires, hurricanes, tornadoes, and a pandemic But through all of this, we will remain Carey strong. We are very hopeful for a strong enrollment this summer and fall. In the near future, we will open our 34,000 square foot student conference center, which will house our BSU, our auditorium, food court, and offices for the Student Center. The COVID-19 pandemic has surely shown us the ever-growing need for medical services, not only in Hattiesburg, but across our nation. William Carey University has broken ground on a new healthcare center. This healthcare center, with 74,000 square feet, will allow our medical school to grow exponentially. The College of Osteopathic Medicine has increased and will increase from 100 medical students to 200. The nursing program will have 600 nursing candidates enroll this summer and will double its nursing program this fall. Physical therapy will increase its enrollment from 50 to 80 candidates starting this fall, and pharmacy will grow and continue to grow each year, adding additional classes. Education is another area that has truly been affected by the COVID-19 pandemic. The William Carey University School of Education has been named the largest in the state, which is truly a significant feat in itself, that we will have such a strong impact on the state's teacher shortage, graduating 521 undergraduate and graduate students in 2018 and adding new graduates each year. You know, there are many things that have become so uncertain to us in so many different ways, in so many different areas. However, 1 Corinthians 13:13 tells us, these three remain. They are hope, faith, and love. The greatest of these is love. And from William Carey University, we pray for you each of these areas, and may they bring you certainty for your future. And now I'd like to introduce Dr. Italo Subbarao. Dr. Subbarao is the Dean at the William Carey University College of Osteopathic Medicine, co-founder of the Hero Telemedical System, LLC. Dr. Subbarao is a visionary leader in mobile telemedicine technology for improving patient care. His efforts with Hero Telemedical Systems include integrating unmanned vehicles and advanced analytical support. He has received accolades from the UN regarding his work, study, and the use of Twitter for disaster response. He was former director of the Public Health Readiness Office at the American Medical Association Center for Public Health Preparedness and Disaster Response, the deputy editor of the Journal of Disaster Medicine and Public Health Preparedness, an official AMA publication, and the medical director for the National Disaster Life Support Program Office. Dr. Subbarao is a leader in disaster response, including terrorism, and is recognized for his work in interprofessional competency development and assessment. He has provided field and technical support to the Haiti earthquake, the Mumbai shootings, the Hurricane Gustavs, Ike, and Katrina, the Pakistan earthquake, and other large-scale events. He has also been a leader contributing to the pandemic preparedness, including SARS, H1N1, and the Ebola outbreak. He has published and edited over 60 books and articles and has been invited speaker to many conferences, which includes the U.S. Department of Health and Human Services, the Center for Disease Control and Prevention, and the North Atlantic Treaty Organizations. Dr. Subbarao is an emergency medicine physician and has completed additional fellowship training in disaster medicine at Johns Hopkins University. Dr. Subbarao completed his emergency medicine residency training at Lee Valley Hospital, Muhlenberg in Bethlehem, Pennsylvania, where he won 3 national research awards. He is graduate of the Philadelphia College of Osteopathic Medicine School of Joint DO MBA program in Healthcare Administration. He lives with his wife and his son in Hattiesburg, Mississippi. Dr. Italo Subbarao.
Thank you, Lynn, for the kind introduction. And I'd like to thank the ADP for the opportunity here to present I'd like to thank our sponsors again, Forest General Hospital and William Carey University. I am now going to screen share my presentation. Okay, so we're going to begin. And really, first of all, I want to, again, thank everybody for the opportunity to present. And, you know, in this most difficult time, I am going to challenge you all to sort of, I know it's difficult, but to dare greatly. You know, we know that our life has been significantly interrupted by COVID-19. Things that we normally would do and the plans we made for the summer and all those things that we had planned, things have changed. Things have changed significantly. And we have seen, we probably have friends and families and know folks that have been, you know, become infected with COVID. Perhaps we may know some folks that may have died. And so we recognize that the pain is real. I know healthcare workers that have become sick from this and it has impacted them. So we know the pain is real. The challenge is great. We recognize the economic ramifications that we're seeing around us. It is very, very challenging, but it will not be forever. And we must find a way forward. We must. And that means we must lift each other up and be there for those who need us the most. And keep walking forward and planning for the future. And really, I'm talking about a shared future, a future by which we are daring to dream together. Because yes, this is a trial, a tribulation, a challenge. But Hattiesburg has been there before. And we've always come out stronger for it. Because Hattiesburg is strong. Strong in faith, strong in love, strong in effort, and ever more strong in community. So we are Carey strong. And I can tell you that as we go through this presentation, I'm going to ask us to dream, but I have to begin with sort of the dream that we've got for the medical school and our plans that we've got going on, our plans of expansion. We currently have a class size of 100. And we, over time, are going to expand to double that footprint. And I'm going to talk in detail a little bit about that. But I think that that dream becomes a shared dream because it becomes a way for our community to start to plan around this growth and what are the needs of this growth and how we can all be there for each other. Finally, I will go over some frequently asked questions that I get when I'm talking to the community and as we're planning for school and things of that nature that I'll share. I want to be very clear here that we must have humility. I don't have all the answers. I think we need to recognize that folks don't have all the answers. We pray for faith in God, the faith of the Spirit to be with us in our guidance. But that being said, we try to use what we know today to help guide us tomorrow. But we must recognize that things can change and change rapidly. So let's start with the Carey story, and let's start with the College of Osteopathic Medicine. So first off, why do we want to grow? Why do we want to double? Why did we even think of doing this? Well, truthfully, Mississippi, when the COM was envisioned and began in 2010, Mississippi actually ranked 50th regarding access to care and overall number of primary care physicians. Today, we're actually 49th. And while that may seem like an incremental step forward, it is nonetheless a real step forward. And part of that can be explained by our class and our graduates that are now practicing both in the Pine Belt area, in Mississippi, and we'll see just a little bit that they're all over this country. So the need for primary care physicians in this state is still very large. Even though we went from 50th to 49th, it's still very large. But last year, we had 81% of our graduates going into primary care residencies. And that was top 3 in the nation per US News and World Report. So we're doing something really good in our curriculum and guiding them where we need them the most. And when you think about COVID and what's happening, the primary care is where you're encountering these patients and these challenges. So we need more of these types of physicians. There has been in the last 10 years, and I would really say in the last probably 3 years, a significant investment in starting primary care residencies outside of Jackson, Mississippi. So we're seeing outside of Jackson a lot of primary care residencies that are growing. And as they are starting to bud and grow, they need a pipeline. And so we're getting increased demand for more William Carey College of Osteopathic medical students. And I think that's a very positive thing. As Dr. Houston mentioned, we have also seen, not just in the College of Osteopathic Medicine, increased demand, but we have actually seen significantly increased enrollment in our healthcare programs, particularly in the School of Nursing, but also with physical therapy and pharmacy. And because of their expansion and growth, they're going to need more facilities. And because they need more facilities, and you can see there's going to be this beautiful new 75,000 square foot health science building that they're about to embark on. The COM is going to inherit approximately 50,000 square feet of additional space. So that gives us the opportunity to grow, to take on more students right here in Hattiesburg, right here in the Pine Belt. And of course, we cannot ignore the fact that with COVID, there is just a greater demand for physicians. Now, it's not just COVID. We had, if you recall, we had this vaping epidemic not long ago. As people started to vape more, we started to see greater deaths, particularly in younger individuals. That gave us great concerns. Every year there's a flu season, and we never know how that flu might mutate. And so there's always something going on the public health and population health side. But where the demand is the greatest is on physicians, and particularly primary care physicians. And, you may not know this. I think it's kind of shocking when you look back, because you have to recognize it takes 4 years. Our medical school, our students come in and they go to medical school for 4 years. For the first 2 years, they're in Hattiesburg, on our Hattiesburg campus. But year 3, they go to all over the state of Mississippi. And probably about 25 to 30 stay in the Pine Belt area, but then another 20 or 30 go to the northern part of the state, the western part, the southern part of the state. So everybody gets our Carey students for the 3rd year. And the 4th year, they have a little bit more flexibility to go to a variety of programs. But when you think about it, it just, so it takes a while to graduate medical students, to graduate physicians. But in about 10 years, we've got over 600 graduates, since our inception. And we have about 35 who are licensed practice, and they are right here in the Pine Belt area, right here, providing care during this crisis time frame. And I think that's a great blessing. It's a profound blessing that we have that extra physician pool and that extra healthcare pool that we can be there during this crisis for our communities. So how are we going to grow? How are we going to double our class size? And we're taking it, and we're going to do this in a responsible manner. And it's going to begin, believe it or not, this August. So this August, we anticipate having 150 DO students. The next year, August 2021, we're going to expand that class size to 175 DO students. And then in August 2022, we're going to expand to 200 DO students. What that really means is within 4 years, we're going to have 400 DO students. Right now, we have 400 in our class, but we're going to have 400 in just the first 2 years of medical school right here in the Pine Belt area. And we, like y'all, you guys probably have noticed this, you know, you've noticed that we were never expecting to do this via Zoom or to use telework and that kind of thing. But we may be finding that for certain things we're doing, we're changing our processes, and actually, they're actually for the better. And we've noticed that in our medical education. So we don't want to just do what we've been doing. We want to do better. We want to be stronger. We want to be smarter. So one of the things we have is we have now implemented telemedical education into our curriculum. And we kept talking about doing it, but this put us in a position where we turned it on. And you know what we found, at our medical school, we work with the community, and we have patients, individuals who have certain disease ailments, and they volunteer as standardized patients so that our students can go and evaluate those patients, and they do it in our medical school, in our clinical area, and they get to evaluate them. We get to assess their evaluation, and then we walk through it on how they can improve their clinical decision-making. And as part of our medical school, that happens on a weekly basis at Carey. And obviously, given the COVID situation, we can't bring those standardized patients into the school. But through the advancement of our technologies that we've got now, we have now that patient is now sitting at home. That standardized patient is sitting at home, and now they're communicating with our student doctors through the telemedical portal, with our physicians watching them, our faculty watching them, grading them, and putting in an evaluation. And so I think that's, and our early feedback is everybody seems to be appreciating this. And I think we're only going to make it better and more robust as we go forward. I think we've already begun a footprint in population health. As I said, before COVID, we were doing a number of vaping forums. In fact, we did a large forum in Hattiesburg, but we've also did forums in Jackson, Mississippi, and other places. And you know, we continue to invest in those areas such as vaping and unfortunately things like domestic violence and abuse, but also emerging infectious diseases such as COVID and other things, because it's so important that our students have that strong foundation. As a family physician, as a primary care physician, you need to have those foundational elements. You will be better for your patients. And now, while we've taken steps in that direction, we're going to take strides. Okay, that's what we're going to, because we're going to innovate that much more. We are looking at different modalities, things like augmented reality, where we can sort of bring into the visual space a patient in a hospital, in a clinical setting, things that, you know, we thought about was going to be 5-6 years in the future, and we have been dabbling in, we're now looking at somewhat earnestly. I'm not saying that that is something we're going to do absolutely in earnest year one, but I think within the next 2 to 3 years, we're going to find opportunities to give our students those kinds of things. Again, it gives us a simulated environment, and it also stresses it's a simulated safe environment. And it also, we want to stress that interprofessional quality of education where you're communicating with your nursing community, your physical therapists, your pharmacists, because in a team-based care, as a leader, as the team lead on a team-based care model, they get the better quality of care. And I think that's what we are trying to do. We want best practices inculcated at the foundational level. But we also have an opportunity here to grow and to promote diversity initiatives, our STEM initiatives. You know, we've been promoting diversity and STEM initiatives. We had a beautiful forum for Black History Month this past year. We've been working closely with Hattiesburg High and the students there, giving them advisors and mentors at the medical school so that those students can come through the medical school and recognize those pathways for their future. And it's not just Hattiesburg High, those openings are for Oak Grove and for Petal and for all our local school systems, including you know, Sacred Heart as well as PCS. So, you know, we look at ourselves as a repository for education and an avenue to stimulate increased STEM activities. But what does this all mean? At least for me, what does this all mean? I asked us all to dare to dream together and to dare to dream big. And I think that really means that there will be a Hattiesburg economic renaissance. And I really feel that that's coming. I recognize it's not going to come like a light. It's not going to be a light switch. It's not going to happen overnight. But I believe if we take steady incremental gains over the next 2 years, we're going to look back. We're going to be bigger. We're going to be stronger. And we're going to see we're going to be more innovative. And we as a community will grow and be stronger for it. You know, we are expecting to add a minimum of 30, and this is in the next 2 years, just the next 2 years. We are recruiting and bringing in an additional 30 additional faculty and staff in the next 2 years. I think that's not an insignificant thing for our area. They'll need places to live, et cetera. Within the next few years, we're going to have 400 William Carey College of Osteopathic medical students here in the Pine Belt area, here in the Hattiesburg area. And what does that mean? I said, dare to dream together. What does that mean for all of us? Well, they are going to need housing. Most don't stay in our dormitories. Most of our medical students, they don't stay in our dormitories. Most stay in housing throughout the Pine Belt area. They love to frequent the restaurants, as you all well know. Just like any student, they love to frequent our cafes. And they enjoy entertainment. And they're going to need entertainment, but not too much. We got really good board scores. We're doing good. We want to keep those board scores high. But of course, I jest and I tease. But in truth, they need these things. And they are going to buy goods and services. They are going to be consumers in this area. And that's a continuous pipeline. And we are getting there. August 2020, we have 150 students. So we are starting to turn that on in August. So just that's why I feel like we are part of y'all, and we are happy to take on that initiative. And we just hope that's the beginning. We hope that's the beginning. So of course, we have to recognize that COVID is around us. And as I said at the outset, one thing I'm going to do is I'm happy to take questions after I'm done. So I'll happy to take questions through the chat box. I was asked to be able to put forth just a few frequently asked questions that I received to try to answer them. Now I want to, again, at the outset say that we must have humility. I don't have all the answers. Nobody has all the answers. If somebody says they have all the answers, you may want to be suspect of that, okay? We're getting data every day. We are learning about things every day. And we are making assumptions today. We are making decisions today based on assumptions today that could change tomorrow. So we're trying to be as flexible. We have to be flexible with that. But the way I'm answering these questions are based upon kind of what we know today. So the first question that I often get asked is, when will we get back to normal? Meaning living life the way we used to live. No masks, usual public gatherings, going to churches, going to restaurants, to ball games, all the things we love to do as Hattiesburgians. Well, we aren't going to get to that level of normal until we have an effective vaccine or treatment. Okay, we're not going to be back there until then. The next natural question often is, well, Dr. Subbarao, how long does it take to develop an effective vaccine or treatment? And the truth is that vaccine development takes time. Optimistic projections suggest that maybe there'll be vaccine closer to the end of this year. But I have to be very honest with everybody, there's no guarantee. There are antivirals and other therapeutics that they're looking at, and that may come sooner. There are clinical trials that are ongoing in that area. Without an effective vaccine or antiviral, how does society reintegrate? Dr. Subbarao, what is that new normal? How is that going to look? And like we said, and like we must find a way forward. We have to find a way forward, but we have to do it responsibly. And doing it responsibly at this time means that the new normal will continue to practice aspects of social distancing. Keeping that 6 feet apart, limiting public gatherings. And we are going to be asked to wear masks. We must wear masks. And again, I say to folks, people ask, what's the value of a mask? The masks that we are going to be using are basically keeping, not letting our respiratory droplets get out. They're getting trapped by the mask. They're not necessarily, though, protecting us from droplets coming in, but if everybody's wearing a mask, hopefully those droplets are not coming out as much as would be otherwise. And so we all remain a little bit more protected. But we must anticipate, that we have to, use telework when possible. I think we're all starting to become accustomed to it, and we're starting to find ways to do it. And maybe some of us are doing it, finding that our businesses are actually working better in some respects. So I think telework is very important. That will be part of this new normal. I think sort of the takeout and delivery pickup for restaurants and retail is going to be part of that new normal. And I think that those in high-risk groups, unfortunately, those that are over the age of 65, those who are obese and have diabetes, high blood pressure, et cetera, those folks, we're going to be asking them to limit their engagement going forward. So I think that's something we always have to think about, those communities, and do what we can for the least of our people and be cognizant of that. The next question that often is asked is, will COVID-19 go away? Will it disappear? Will it come back again in the fall and the winter? And again, experts at this time believe that COVID-19 will not disappear. We are seeing it spread right now in the Southern Hemisphere, the way the flu spreads in the Southern Hemisphere. And so we feel that it will be somewhat seasonal and will remain a threat and potentially reemerge again in the fall and winter along with the flu. That would mean that we must, at a minimum, get our flu shot. So that's something that we have to do. But I think we have to prepare psychologically that it can reemerge again. And again, that you never know based on how what happens with this disease entity with COVID is the closer we are, the more dense we are. And when we think about the winter, fall and winter, oftentimes we're indoors and we're closer to one another. Usually the spread is greater in those kinds of environments. So we just have to recognize that potentially could reemerge, and we may have to go back to some level of social distancing again. When will K through 12 be going back to school? Oftentimes that's often asked of me. I've got a child. It's difficult to do homeschooling. Let's give awards to our teachers who have done a marvelous job with our kids, and we're getting a little bit of that exposure now about how great a job they have been doing. But the truth is, it's a bit too early to say. Studies have shown that children have had minimal illness compared to other groups, and that is good news. But children in general are super spreaders of infection, and that means they can pass along their germs to parents and grandparents, and so that is the big concern. So we kind of really need to see where we are closer to when school restarts. But I would say to all parents out there and everybody that we have to prepare for interruptions, and we have to continue to build those online education modules and capacities. And I do think that reinforces the need for all of our businesses to have flexibility and to afford telework options. I get this question, of course, I'm at the medical school, so I get the questions of when will colleges and universities be going back to school? And again, I think it is too early to say. Similar to children, we are seeing sort of minimal illness in that group. But again, they are super spreaders of the infection. And what happens is you've got dormitory-like settings that are very dense. And you've got, other public gathering places and spaces where students like to be around one another. I mean, we remember our college days. That's part of the college experience. So we have to do this responsibly. we have to ramp up our testing. You know, our testing capacity has to be ramped up in such a way that if something were to happen on a university or campus, you can get in there quick and identify those folks and remove those folks. So those are things that have to be considered. But I think it's a little bit too early to say, but I think responsibly, you know, we will need to see where we are as closer to school starts, but I think we need to prepare for the contingency plans of continued online delivery and interruptions to education, and obviously look at ways that we can look at classrooms to try to have it spaced out in a way that if students are back, they're spaced out in a way that they're safely at least 6 feet of distance from one another. I get this question a lot. This comes from a lot of some business folks that ask me this question. They ask me, are fever screens effective? Well, I will tell you that at this time, if anybody should have a fever, they should not leave their home. They need to call their primary care doc and they need to get COVID screened. And that is what they have to do. So if you have a fever, you don't go to work, you have to call your primary care doc or go to the fever and cough clinic that Forest Health has. That would be the recommendation. However, we must recognize that it's imperfect and that, you know, we need to use this with caution because a number of studies have demonstrated a significant number of individuals that have been infected with COVID-19 who are asymptomatic, meaning they don't have the fever. They're asymptomatic, but what they're doing is they're shedding virus. They're spreading that out. And if you're asymptomatic and spreading it, that's what keeps this wave coming. And I think that, as noted, certainly nobody should go to work with a fever, but that's why I say when our fever screen's effective, use with caution. I want to come back to, you know, just Carey and sort of what we've done in a short window of time and how that's really impacted in some ways, in some dramatic ways, the COVID crisis. You know, many times we sit in Mississippi and we're so thankful. We've got wonderful leadership. I think our mayor, Toby Barker, has done a tremendous job. Dr. Rambod is a fantastic public spokesperson. And, you know, we've got great folks, you know, Governor Reeves and his team, Dr. Dobbs. They're outstanding and they're doing what they can given the situation, this difficult situation. But in truth, we must realize that, you know, in 10 years, there has been a drastic need for physicians. And in 10 short years, Carey answered the call. And we've got over 600 licensed and practicing physicians around the country right now as we speak. We've got 600 physicians that are on the front lines today, on the front lines in hotspots like New York City. We've got Mississippi kids that are from Laurel, Mississippi, Hattiesburg, Mississippi, that came to William Carey, that are currently in New York and the New York area treating COVID patients and with the desire and dream to come back and practice in the Pine Belt. So what I'm saying to you is that the work that, you know, our kids, the work that we've done with our hospital systems here, the education we have provided has been invaluable. They have gotten a tremendous education here at Carey, and they've gone all over the state, all over the country. As you see the map, you can see that wherever there's a hot spot, there's probably a Carey graduate there. And they're probably in a primary care profession and specialty. And that means they're going to be on the front lines with COVID. I can tell you we've got 35 right now who are licensed in practice in the Pine Belt area. We've got close to about 100 in the state of Mississippi as we speak. And when you look at the Gulf South, we've got lots in the Gulf South, lots in rural areas. And that's how we train our kids. They get that training right here in Hattiesburg, Mississippi. No matter if they decide to go to the Northeast or decide to go somewhere else to practice, they will always have Hattiesburg in their heart. And I think those communities are grateful for what we've done here in Hattiesburg. And I commend the ADP partnership. I commend Forest Health, Merritt Wesley. I commend our healthcare and physician community. We partner with over 50 hospitals in the state of Mississippi. Over 500 clinical physicians provide faculty advice to our students. And so, you know, and y'all, through your business entities, you've housed these students. You've given them goods and services. You've given them entertainment. You've given them refuge during their education, which is very trying as a medical student. And we're going to need that refuge as we go forward, because we're only going to do more of it. And so we're proud to highlight this. On the backside, of course, we have donated personal protective equipment to a number of hospitals. We have students that have manned COVID hotlines for the Mississippi Department of Health. We have worked with our hospital partners. Some of our, again, students are manning a hospital COVID line for some hospital systems. We have, I'm doing some contact tracing there. We've been helping support lots of hospitals for the first time are using telemedicine. So on the back end, we've supported that. So there are lots of things that we've been doing to help and to work with our partners. And so I just want to conclude by saying, let us dare to dream together. And by doing that, let us dare to allow COVID to inspire us to become better than we are. We must move forward. We cannot remain in our homes. We have to find a way forward. And we will do that together. We must still grow and innovate. And we got to be there for each other, to lift each other up and be there for those who need us the most. But if we work together, we can plan together for a much more exciting and better tomorrow. Just like Katrina and the tornadoes, we will get back and we will be stronger, and we are Carey strong. I want to thank everybody and appreciate Chad Newell for the opportunity to present.
Good afternoon, guys. I'm Chad Newell, president of the Area Development Partnership. We are elated that you joined us today for this Zoom video conference. Dr. Subbarao, thank you, sir, for that incredible presentation. Greatly appreciate your knowledge, your energy, your passion, and your humility. You bring a great deal not only to William Carey University, but certainly to our community, region, and state. So thank you for your leadership. I love leaders. I love grooming leaders, and I love seeing other leaders perform. So what a wonderful presentation. We also could convert you to an economic developer, because you obviously fully understand the economic impact of what William Carey's doing here in the community. And you did a marvelous job outlining the student growth and the growth with faculty and staff. And guys, that will have such a domino effect in our community. What a great economic impact. So you're not only providing world-class healthcare training, but you're providing a phenomenal economic impact here in Greater Hattiesburg. So very exciting. Many thanks again to Forest General Hospital and William Carey University for sponsoring. Dr. King, we appreciate you and your leadership at William Carey. You guys know how to pivot. You know how to find a seam and then seize the moment when there's an opportunity to offer a new program. So the growth with the health sciences, all of the health fields at William Carey is just pretty staggering. It's phenomenal and something that we're all proud of and all very excited about. Forest General, of course, is our largest employer here in Greater Hattiesburg. They are on the front lines daily during COVID-19. So we appreciate Andy Woodard, the CEO, and all the leadership at Forest Health. They are quite an economic engine and quite a healthcare provider here in our community. I want to highlight a couple of other things before we depart the video conference today. Our June 5th Accelerate program is coming up, and I'm very excited to say that we have assembled a stellar panel for the June 5th Accelerate program. It's entitled, Don't Ignore the Warning Signs, How to Survive and Thrive During COVID-19. And really it revolves around that whole physical, mental, emotional, and spiritual well-being. I often talk with our employees, our staff, about the importance of the whole you, of being well physically, mentally, emotionally, and spiritually. And so we're very pleased to have two pastors joining us for the panel discussion, Marcus Cathy and Jeff Clark. And we'll have a psychologist, Dr. Geraldine Datz. And then on the physical side, we'll have Matt Lee with Versus Strength and Conditioning. So please make plans to join us for our Friday, June 5th Accelerate program via Zoom, again at 11 a.m. to noon. Next, I want to highlight our gift card bonus program that our chamber team has implemented. If you are an area business and would like to participate, please contact Ann Scott Mathis or Jace Henry on the ADP team. Their email addresses are located at the bottom of the screen. And we are doing this in partnership with the Petal Area Chamber. So if you're a Petal Chamber member, please contact Valerie Wilson at valerie@petalchamber.com. The gist of this program is it's good for the consumer, it's good for the business, it helps our businesses during a crisis, and it's really going to help your pocketbook post-pandemic, because in essence, the way it works is you can purchase a $50 gift card from a local participating retailer or restaurant, and you can redeem the gift card after July 1st in coordination with that particular entity for $75. So you buy a gift card today for $50, and that particular business may not be open or may be open with limited hours or limited access now. But once they are fully operational, your gift card will be worth $75. So it's a great program and service to help stimulate the local economy. And that's what we do at the Area Development Partnership. We want to see our local businesses grow and prosper. So please stay tuned next week as we roll out this wonderful program, and I encourage you to participate. Finally, let's grow together. At the end of the day, we want to ensure that the Area Development Partnership remains extremely relevant and visible during COVID, and that we are ready to help these local businesses not only now, but we want them to survive and thrive post-COVID. So we want to certainly enhance our membership base. We want to retain the members that we have by providing world-class programs and services, but we also want to recruit new members. So this is a great opportunity for you. If you are currently an ADP member and have a friend, a relative, a colleague who you think could derive value from being a member of the Area Development Partnership, all you have to do is contact Ann Scott or Jace, make the referral, and if the prospective member signs up with the ADP, then you will receive a $100 gift card. So not only, again, does it help you and help us at the ADP, but it helps our fellow member businesses. So definitely let's grow the ADP membership together. Finally, I want to give a shout out today. We have students on the call from Hattiesburg High School from their health sciences and sports medicine curriculum. So want to give a shout out to the students who took the time to join us today. I know that you guys learned an awful lot from Dr. Subbarao, and I want to thank all of our participants today. We greatly value our members of the ADP, and as we always say, we want you to grow personally so that you can flourish professionally. So we look forward to seeing you around on Zoom for future programs, and then hopefully as the clouds clear and the brighter days lie ahead, we look forward to seeing you in person as well. Thanks so much, and have a wonderful weekend.